So this is the first of two short screencasts about polycystic ovary syndrome. And the reason for doing this is that it's highly likely that you will come across women living with PCOS. And in some places, there are clinics purely for women with PCOS. So some of you will end up supporting this kind of area. So what I'm aiming to do over the two screencasts is to give you this overview of what PCOS is and how it's managed, so that by the end of it you can describe what it is, you can critically review some of the possible causes, and you can discuss the management through diet, through physical activity, lifestyle change and medication. So let's start talking about the prevalence. So this is one of the reasons why it's so important for you to know about it, because it is one of the most common endocrine disorders that affect women. And there are different criteria for deciding whether something is PCOS or not, but that leads to this understanding that some of the papers have shown an incidence of 2.2% and some as high as 26%. Most people would say about 1 in 10 women are affected. And what it's really important to know is that just because someone has polycystic ovaries doesn't mean they have polycystic ovary syndrome. So the two things are not the same, and more women will, if you were to scan them all, would have polycystic ovaries, but don't have the other symptoms. There is a huge difference in relation to ethnicity. And there's a few papers that have looked at this, and the incidence seems to be very low in Chinese women, Caucasian women, and it gets higher in Middle Eastern women and highest in Black and South Asian women. And another study has demonstrated that when looking at Aboriginal women and South Asian women, when they migrate to developed countries, so if they were living in developing countries, move to developed countries, they are much more likely to develop symptoms. And of course, that suggests an environmental impact as well as the ethnicity. So let's just have a look at what it is we're actually talking about. We're talking about an endocrine hormone disorder that emerges at puberty, and that's because it's related to the sex hormones. And we call it heterogeneous because it's a number of hormones. It's not one hormone that's causing the problem. It is the leading cause of infertility in women, and it's not unusual for there to be a family history, but there isn't always. Symptoms are on a spectrum of very mild, having a minimal impact on life, to very severe and having very significant impact on life. Those who have mild symptoms are much more likely to be diagnosed later in life, whereas those with the more severe symptoms are likely to be picked up in their early teens. So what symptoms are we talking about? Irregular or absent periods. This is because eggs are not released regularly. One of the most distressing aspects is excessive hair or hirsutism. And this is very much in a more masculine pattern. So on the face, chest, back and buttocks. So places where women don't normally have hair. But in contrast, the hair on the head and the scalp is very, very thin. Again, something that is not normally an issue for women. Acne and oily skin, often an issue, of course, during the teens, but worse for women with PCOS. It's very difficult to get pregnant, and there are a number of reasons why controlling body weight is difficult. And of course, you've got the polycystic ovaries themselves. So if someone was wondering, have I got PCOS? These are some of the things that they may be able to identify. So they may feel tired or fatigued, hunger all the time. So people are constantly hungry, which of course relates to the body weight. Losing weight is very difficult. There are cravings for carbohydrates, sugar in particular, but after meals people may feel fatigued. They have aches and pains. high cholesterol levels, triglycerides, and this whole idea of this hormones that mean they're more likely to store fat, have abdominal obesity, and all of this is feeding into the idea of insulin resistance, which again then impacts on hormones. So you've got lots of things going on, and hopefully you can see immediately why maintaining a healthy diet and maintaining a healthy weight is difficult. But there's also long-term complications to consider, and fairly obviously insulin resistance and then subsequently type 2 diabetes, which of course leads to this increased cardiovascular disease risk. Infertility I've already mentioned, but also a higher instance of problems in pregnancy. Gestational diabetes, again, kind of makes sense. Preeclampsia, in case you don't know what that is, that tends to be very high blood pressure, protein being lost in the urine, swelling and fluid retention, particularly around the feet and ankles, but also face and hands. There can be a lot of headaches, there can be visual disturbances, pain around the ribs, and this can be very serious. This needs treatment, it needs hospitalization in order for people to be treated. So something that would be looking out for with a woman with PCOS who was pregnant. There's an increased risk of endometrial cancer. Not surprisingly, there is anxiety and depression related to PCOS, and also obstructive sleep apnea. So there's a lot of things that can be really causing great disturbance and difficulties for women living with PCOS. So how is it diagnosed? This is through measuring the hormone levels. So we've got a disturbance in the sex hormones, higher levels of the male hormones. So these are things that can be measured in the blood. You may also do an ultrasound scan to look for the polycystic ovaries. But sometimes if the hormone levels are clearly abnormal and you've got all the symptoms, ultrasound may not be necessary. And you certainly wouldn't do it on adolescents. And what we call cysts are fluid-filled follicles, and you'd expect at least 12 in one ovary for a diagnosis of PCOS. And of course, it's important to rule out other possible causes of all the symptoms. So what do we need to be thinking about with women living with PCOS? So the stage of life, whether they are still a teenager, whether they are likely to want to be getting pregnant, all those kinds of things to consider. Certainly ethnicity and family history. Is this something that other women in the family have experienced? Cardiovascular disease risk, gestational diabetes, pre-diabetes, type 2 diabetes, they're obvious ones. Be very mindful of quality of life and mental health, emotional well-being. And not surprisingly, many women have a disturbed body image, and this whole picture can often lead to eating disorders or disordered eating as people struggle with trying to control their dietary intake and their weight. And the culture that people come from, how they might be treated in their culture, is really important to be mindful of as well. And of course, recently, in the last few years, we've had COVID-19 to consider, but women with PCOS, younger women often, teenagers and upwards, and of course, you wouldn't normally consider them to be at high risk. But when you think about all of the associated factors that could be there, particularly thinking, it's more common in South Asian and Black women, but all the cardiovascular metabolic things that are going on, women with PCOS are at increased risk of having problems and severe problems with COVID-19. So there's a strong overlap of risk there. So what's causing it? Who knows? It's not really clear. And it's likely to be a number of factors, including genetics and the environment. We know obesity is related. Which comes first? Is it the insulin resistance or not? But then, of course, not every woman with insulin resistance goes on to develop PCOS. And if it's related, starts from puberty, then that doesn't make a lot of sense. There clearly is a genetic link sometimes, but it's not a dominant gene, so it's not a foregone conclusion that a woman will develop it if their mother had it, for example. And hormone imbalance, we know, is common. What's causing it? What comes first? Not really sure. It's a bit of a chicken and egg type situation. But clearly, obesity will make the symptoms worse, the insulin resistance worse. So we've got to be thinking of those kinds of issues and trying perhaps to do something to intervene in that process. So we're still really unclear as exactly what the triggering factors are. And what we do need to think about with women living with PCOS is this kind of vicious circle or cycle that they're going to be likely to be experiencing. So because of all those symptoms, the hunger and the sugar craving, there may be uncontrolled eating. There may be comfort eating if there are issues that people feel about their body image and their looks. But of course, the more of that type of eating you get, the more likely you're going to get increased insulin. There's a feeling of being out of control with uncontrolled eating and comfort eating, and that's quite difficult. But that also potentially makes PCOS symptoms worse with weight gain and increased insulin and, of course, therefore more fat storage. So people will try and restrict their intake. They might skip meals, be on quite strict diets, which are difficult to handle, and that may lead to low confidence, low mood, and we're just all kind of going around in a circle. So we've got to try and support people in a way that helps them to intervene and control some of the aspects that feel very out of control. So the second screencast will talk through the treatment options and how we support women living with PCOS.